So, breast breast milk, as we all are well aware, that it is the first and the major point of nutrition for the newborn. Not only for its nutritional components of both macro and micronutrients, specifically if you look at the macro and micro, the two components of breast milk, that is the first few days of colostrum, is higher in its fat percentage, and as it moves into the mature milk, the fat basically increases and protein reduces. The colostrum is majorly has a larger percentage of protein. Apart from the macronutrients, breast milk contributes a well balanced nutrition of through nutrients of minerals and vitamins also, both again various micronutrients. It's only vitamin D and K that is definitely deficient in this. Now, apart from the macro and micro, the various hormones and growth factors are also an important component of human breast milk. And the microbial communities of Staphylococcus, Streptococcus, Lactobacillus, and Propionibacterium is also well known. So the recent work that we always see on microbiome and gut starts right from also the contribution from breast milk. Apart from this, the microRNAs are also help in constructing the infant's immune system through the intestine. So the microbiome and the microRNAs are the two important components contributing to the immune components of the human breast milk. As I was saying, just saying you, the stages of breast milk, the nutritional component changes. The first secretion, the colostrum, is from birth to 3 to 5 days, is mainly high in protein. It's easy to digest and has a maximum immune protection. The next transitional milk, which is after the 3 to 5 days to 14 days, the quantity increases. It has little more calories, fats, and the lactose. Whereas after 14 days, which is what is the mature milk, contains all the major nutrients. The composition of the mature milk also varies in terms of the initial milk, which is the fore milk, that which satisfies the baby's thirst as it's high in lactose and protein, versus the hind milk, which is secreted later on the suckling, which is satisfies hunger as it's high in fat and calories. We also need to remember that the quantity of breast milk secreted is proportionate to the size of the newborn stomach. Day one, the size of the stomach is hardly the size of a cherry, so you would definitely require just 5 to 7 ml of breast milk, over moving over to the size of the egg as it reaches the first month of life. And hence, the breast milk secretion also uniformly improves. It's interesting to note, and each one of us as practicing dietitians should be aware that the energy and micronutrient composition of the human breast milk varies. And as I just said, there is a difference in the micronutrient comp as it moves from the stages of colostrum to mature milk. Further, if you look at the carbohydrate content in the mature milk is almost 60 to 70 grams per deciliter. And of the total energy that's provided per 100 ml, about 70 kilocalories per 100 ml, 50% of the calories is provided or is got from the fat in the breast milk. As versus the bovine formula or the recommendation that is there to get from formula or cow's milk or bovine milk is almost, this is the recommendation that is given in, and as you observe, it's not as equivalent to any of the components. Moving on, the benefits. Yes, breastfeeding has its benefits both for the infant and mother. For the newborn and the growing baby, it supports the baby's growth and development, definitely reduces the increased overweight in babies, reduces allergies and eczema, prevents pneumonia, diarrhea, and airflow infection, there's optimal brain development and greater IQ, and boosts the immune system, and a bond between the mother and child is what are some of the benefits. Coming to the benefits to the mother, it reduces the risk of breast and ovarian cancer. Breastfeeding prevents postpartum depression and type 2 diabetes, helps to the mother to lose weight after childbirth, and bonds a mother and child and hence a happy family. As we look into the various studies that have been going on to actually look at what should be then the maternal nutritional intake or the dietary intake of a mother who's feeding her baby. Over the century, we have had various studies and researchers have been looking into. This systematic review that looked into over a century of what the work was, they have found wide changes in the macronutrient levels in Indian mothers' milk. This systematic review, mothers belonging to different regions, socioeconomic strata along the various gestational ages, the various lactational ages, maternal dietary intake and nutritional status were included. And it has been observed that studies prior to 1980, the highest fat was observed in colostrum versus other stages of lactation than that reported by recent studies. As I earlier said, recent studies have confirmed that we have higher protein content in the colostrum. The other changes, this review, as the paper explains, they had included all observational, interventional, or supplementation studies and excluded publications of micronutrients and studies on preterm. The colostrum was reported as ranging from 1.83 to 4.59 grams per 100 ml in the colostrum versus matured milk, which was 2.7 to 4.78. Protein was higher in colostrum, 1.54, and lactose was lower in the colostrum versus the other milk. Just to give you a brief, over this paper, when they have recorded and when they have reported, if you notice that the macronutrients of protein, fat, lactose, what was reported earlier versus after 2010 is definitely less. So we related to better analysis methods versus various other components, as we just said, can contribute the contribution to this macronutrient. So it's not easy to directly look at what was a mother's intake during breastfeeding versus her breast milk composition. So for the slides, I'll explain why that's so. Always, as we have started seeing of late, the increased incidence of mothers moving into adults moving to accept vegetarianism or more specifically veganism. So the challenge always has been to look into is the breast milk variable? So this study where the dietary patterns and breast milk composition was compared for a vegetarian and non-vegetarian diet, it was observed that there was no significant difference in particular dietary groups with regards to the total protein concentration in breast milk. So it's always mothers are very anxious. They come and tell, is my protein intake adequate? Should I be eating more? But studies have repeatedly shown that whether a vegetarian diet, whether a mother or a non-vegetarian diet, no significant difference in the breast milk protein composition. In the period after 7 months of lactation, milk samples from the vegetarian mothers had lower content of protein than those on the non-vegetarian mothers. And it was also reported that even though vegetarians consumed fewer total protein than non-vegetarians, both the groups covered 100% of the RTA. So there is nothing to be concerned when we talk to a vegetarian diet based who is eating a vegetarian diet versus a non-vegetarian to look at that the nutrient recommendation on protein need not be additional. So I stress most of the time vegetarian mothers who are on exclusive vegetarian diets always have the concern that should I take an additional protein supplement? So the answer is no. Dietary patterns and breast milk composition, when further, the only nutrient that looked at, what we need to be looking at specifically is vitamin B12 because the mean serum and vitamin B12 levels were lower in the milk from vegetarian women than from the non-vegetarian control groups. So the lower vitamin B12 concentration in milk from mothers following the meatless diet was reported. As regards fat in the comparison in these two groups, the total fat content in breast milk seems to be more affected by the maternal age. There was no significant relationship to the stage of lactation or BMI. The maternal BMI in mothers following a meatless diet was significantly lower than in omnivores. And when it comes to trans fat, the mean breast milk trans fat concentrations were low, below 1.1%. So study participants were well nourished in the study, so the dietary fat intake did not significantly affect the breast milk composition, even though vegetarians consumed less fat than non-vegetarians. Further, this paper also reported on the DHA, ALA, and EPA levels. Breast milk of vegan mothers was observed to be deficient in DHA. As an alternative for vegan mothers, algal-derived DHA accepted by FDA is also available, is what this particular study reports. ALA, DHA, and EPA, as we all know, aids in the development of retina and central nervous system. Vegans do consume a good amount of omega-6, but only marginal amount of DHA. So serum levels of DHA and EPA were found to be lower in the vegans and vegetarians when compared to non-vegetarians. And similar results were obtained in studies investigating the omega-3 fatty acid in breast milk, cod milk also. So the only component that you would find slightly less or lesser than the non-vegetarian is these essential omega-3 fats. In comparison to non-veg, the vegetarian's breast milk contained less C16 and C18 and was richer in omega-6. The results seem to reflect the difference in their dietary intake, and vegetarians consume less oleic acid than non-vegetarians. As vegetarians consume less fat, their milk proved to have a higher level of C10, C12, and vegetarians' breast milk contained reduced level of saturated long-chain fatty acids and a higher level of the POFA. As regards lactose content, the lactose concentration in breast milk samples from the vegetarian mothers were found to be similar to the lactose content of the non-veg mothers. Further, the lactose concentration remained stable during the course of lactation. It did not change. This is something that always happens when a child is on formula feed. So the concentration keeps changing for them, and that can be one of the reasons on frequent stomach upsets. But here, breast milk, most of the time you notice the lactose concentration remains the same during the entire course of lactation. Dietary intake of carbs did not affect the lactose concentration in the breast milk. Further, as we look into a detailed, yet another systematic review, which is done and reported in an American Journal of Clinical Nutrition, energy levels when the systematic review says that a higher breast milk total energy content was observed for a diet low in carbohydrates and high in fat than with a diet high in carbohydrate and low in fat. The carbohydrate content of the diet, there was no significant relation found between breast milk's total carbohydrate and the maternal dietary intake with a vegetarian compared to non-veg, as I said. But when it comes to total protein content, the higher breast milk total protein content for a maternal diet high in protein was observed than with a low protein diet. But no difference was specifically observed in terms of lactoferrin or alpha-lactalbumin in the breast milk. It's only in the total protein that a difference was noted. With regards to fat, a higher proportion of breast milk total fat with the maternal diet characterized by low carbs and high fat compared with high carbohydrate, low fat, and higher concentration of total fat in milk with a high dairy diet was observed. So, would like everyone to notice that the proportion of breast milk total fat is higher on the maternal diet being low in carbs and high fat than with a high carbohydrate diet, right? Compared to the distribution of SFAs, distribution of the fatty acids, there was a positive correlation observed between breast milk's total saturated fats and maternal intakes. Positive correlation was found between the total MUFAs and also between the total PUFAs. So all the fatty acid components was positively related to the maternal dietary intake, specifically from the high-fat dairy products. As regards to vitamins, it was only vitamin C and vitamin E that reported a positive correlation between breast milk content and maternal dietary intake. With regards to minerals, zinc and selenium has shown to be influenced by maternal intake. There was a positive correlation between breast milk, selenium, and maternal intake of eggs, but no correlation with the consumption of other fish. Further, we have this study which again draws our attention to what should be the right proportion of the macronutrient in the maternal diet. So this particular study, which studied the dietary patterns of macronutrient composition, again a systematic review and meta-analysis, studied on 4 different dietary patterns. So here they studied the dietary patterns varying in its macronutrient distribution. So the first one, which they called RR, had 20 to 30% of the energy from fat and 12 to 15% of energy from protein. Whereas the high fat and high protein diet component, they took in a little 30% of energy from fat and reduced, that is, 15% of energy from protein. The rational fat but high protein. So what they mean here by rational is optimum level. So the third group they studied, they had was an optimum fat but high protein, where 20 to 30% of calories and yeah.
Ma'am, like our meeting time is showing by like another 10 minutes it might end, but it is already a paid service. If in case if it is ending, we can rejoin in for just another 5 minutes. Not even just rejoin again, everyone.
Sure. Thank you. So the third group that they studied was 20 to 30% of calories from fat and a high amount of protein. And the fourth was over 30% of calories and a balanced amount of protein. So what they varied was in terms of fat and protein. And while they studied these 4 dietary patterns, what was observed was the fat content in the mature milk was increased with increments of fat intake. So as fat intake in the diet increased, the fat content in the mature milk also increased. The protein and lactose contents in the mature milk did not increase with their intake for lactating mothers. So just going on, adding on either excess carbs or excess protein did not get on an increase with the mature milk. So among these 4 dietary patterns, the energy ratio of macronutrients in human milk at the RR level, that is the optimum levels that we looked at, that is what we say about 20 to 30% from fat and 12 to 15% from energy. So this composition, which is what we actually do in our balanced diet formula, it was the energy ratio of this was closest to the estimated energy ratio for infants aged 0 to 6 months. So the milk, the human milk of this group that was having their diet from this ratio seemed to be optimal. Thus, the optimal dietary pattern should be advocated, and the irrational dietary patterns, especially high fat or high protein dietary patterns, should be avoided during the lactation stage. So this systematic review definitely gives us conclusive evidence that there is no reason that we need to push in excess of any macronutrient. There's yet one more, of course, this is a single center study from Istanbul. They also evaluated on the effect of different diets applied to breastfeeding mothers on the composition and quantity of human milk. So here, the researchers had 3 different components of diet that they studied. They had diet 1, they gave it to the group where the energy distribution was a healthy plan, that is a balanced diet, that is 55 to 60% carbs, 12 to 15% from proteins, and 25 to 30. So almost they followed the Turkish guidelines they have said is almost similar to our Indian dietary guidelines where we have the distribution of the macronutrients. They had the second group, which was carbohydrate rich diet where they had carbs taking 65% of the calories from carbs and the rest from protein and fat. And the protein rich diet, the third group, which provided 25% of the calories from protein. But what they did in the study was to alter the macronutrient composition. They just altered the amount of foods in the healthy nutrition diet only was adjusted. They didn't go for adding on anything. So the same balanced diet plan, to that they added the same food groups or modified the food groups such that they could alter the nutrients. The results, compared to the healthy nutrition diet, there was a statistically significant increase was observed in the levels of amino acids in the milk following the carbohydrate-rich diet. Need every one of you to note, it is not that you need to be giving higher protein in the maternal diet to increase milk protein. The high carbohydrate diet had higher protein levels in the breast milk versus the healthy nutrition diet. In contrast to the healthy nutrition diet, the lactose content of milk decreased after the carbohydrate rich diet. Following both carbohydrate rich and protein rich, there was a reduction in riboflavin content observed. So, by pushing in too much of a macronutrient, you are having a negative impact of an important B vitamin being lost in or reduced in the human milk. After the protein rich diet, an increase, of course, in milk quantity was observed. So, a high protein diet does give an increased milk quantity in terms of quantity compared with the protein carbohydrate rich diet. This was not compared with the healthy nutrition diet. They just compared protein rich and the carbohydrate. So, compared to carbohydrate rich, the protein rich diet did give them higher lactose content and also more milk quantity. So, apart from the micronutrients, as I earlier said, we have enough work now going on maternal pre and probiotic intake and its impact on the immune factors. So, administering probiotics to the pregnant and lactating mother definitely has shown an increase in the immunoprotective potential of breast milk, as assessed by the anti-inflammatory growth factors that was assessed. But the risk of developing atopic eczema during the first 2 years of life in infants whose mothers received probiotics was observed to be significantly reduced. There is yet another detailed study, the SIMBA study, wherein they studied the maternal prebiotic supplementation on the human milk immunological composition. Of the sample of 261 samples, they had analyzed at 3 points. Some immunomodulatory proteins were common features of milk composition were found to be the assessed. And in contrast, there were cytokines that were detected less regularly. So overall, they observed that the immunomodulatory proteins analyzed in the human milk showed a wide range of concentrations. And after evaluating the effect of prebiotic consumption on individual human milk, the assessment was done at 2nd month, 4th month, and 6th month. A notable decrease in the levels of these 4 proteins from prebiotic supplemented mothers was observed. So this study also shows, yes, there is an improvement in the immunological factors in terms of prebiotic supplementation. So they've concluded that the prebiotic supplementation during pregnancy and breastfeeding did not alter the overall milk immune composition, but selectively altered the levels of these 4 important immunoregulatory factors, that is TGF, beta-1, TSLP, IgGN, and SCDL14. This finding is important for us to guide a prebiotic dietary recommendation for pregnant and lactating mother and underscores the potential for dietary interventions to modify the immune properties of human milk. So the importance of including it, because it will not overall does not increase the immune composition, but selectively alters these immunoregulatory factors. So what is on the whole the effect? We need to understand that the composition of the breast milk does depend to some extent on maternal nutrition. But we need to also understand that even an undernourished mother can successfully breastfeed. It is only in the case of severe malnutrition that both the quality and quantity of breast milk will be affected. In fact, Various studies over the years have shown that the protein content is less affected as compared to the fat content. So the protein content, even if it is slightly lesser than the recommended dietary allowance in the mother, it has less affected in the breast milk as the fat content. So the fat is less, yes, the milk fat is also observed to be less. I just wanted to draw attention on the various components of fat also. So the effects of dietary fat on breast milk is the fat content in human breast milk is closely related to the maternal diet and weight gain during pregnancy. In addition, there are I wonder where I was once. I'm taking support from my colleague who actually helped me with these slides. Let me check. Resolution. Okay, thank you.
Ma'am, you were talking about fat.
Yeah, thank you, Shan. Yeah. So I was just completing on this study wherein Ravlika, can you unmute and just let me know if that's fine? Ravlika, can you hear me? Ravlika or Sumrana, anyone, can you let me know if I can continue from here?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Right, thanks. Sorry for that confusion. I didn't realize actually we are off and I was actually busy talking. Okay. Right. So I was just telling that the effect of maternal nutrition on breast milk when we try to put on in comparison or in conclusion, the composition of the breast milk depends to some extent definitely on maternal nutrition. But we need to understand that even undernourished mothers can successfully breastfeed. It's only in the case of severe malnutrition that both the quality and quantity of breast milk starts getting affected. Protein content is less affected as compared to the fat content. So the effect of maternal nutrition as far as the fat is, the fat content in human milk, human breast milk is closely related to the maternal diet and the weight gain during pregnancy. So these are two important factors that have shown to have to decide on the fat composition of the human breast milk. Of course, there are regional differences also in food intake. Various studies have shown that even these have contributed to the change in the fat content. The consumption of foods which are high in trans fats, so the breads, snacks, fast foods by the lactating mother, can definitely cause a trans fatty acid to be found in the human breast milk also, and may also account up to 7.7% of the total fat. So every practicing dietitian should make this a point to get it across to the lactating mother to limit or definitely avoid the trans fat based foods. Trans fat concentrations varied again from region to region, and they have definitely, as we all know, adverse effects on the infant growth and development and is inversely related to the linoleic and alpha linoleic, so DHA-rich fat. Arachidonic acid is yet another fatty acid which has shown a positive correlation. So the arachidonic acid rich food intake from the lactating mother and the EPA and DHA are also shown to be closely related. So with this regard, vegetarian may have a very low level of DHA in their milk because of the lack of fish or other foods rich in their DHA diet. Therefore, this paper recommends that to take up to 300 milligrams of DHA per day to maintain sufficient amounts of DHA in breast milk. But as we all know, in India, we still don't have a universal recommendation for DHA in pregnancy or lactation. So breast milk, is it nutritionally adequate? Yes. Breast milk usually is sufficient to support infant growth. And the composition of the breast milk is believed to be remarkably or unaltered in case of limited energy and nutrient intake in the mother. So even if there's slight reduction in the nutrient intake or in the little energy intake, it does not alter the composition of the breast milk. However, persistent dietary restrictions during the lactation period can result in the depletion of maternal body reserves, and it negatively affects both breast milk volume and content of the specific nutrients. So what we need to be aware of, what are these critical nutrients? These critical nutrient concentrations, which have shown to be significantly affected, are proteins, polyunsaturated fatty acids, especially with impact on omega-3, vitamin D, vitamin B group of vitamins, but especially B12, iron, and iodine. So these critical nutrients we need to be aware of, so that various studies have shown that it can alter its content in the human breast. We need to remember that a mother's capacity to produce milk of sufficient quantity and quality to support infant growth is resilient and remarkably resistant to nutritional deprivation. That's a miracle of nature that has created that even if the mother is deprived of certain energy levels in her lactation phase, the breast milk production is not remarkably altered. However, the milk production normally affects definitely the maternal body composition and nutritional status, and as the lactating mother has increased demand. So it bites into her reserve and it definitely impacts or affects her body composition. Hence, a balanced diet is what is recommended for optimal milk production. The quantities as will be slightly higher than what's recommended during the last trimester of pregnancy. So to meet the additional demands for the energy yielding foods, protein, the recommendation as given by ICMR and iron is basically additional 600 calories during the first 6 months of lactation with additional 520 in the second half of lactation. Protein content, additional 13.6 in the first half and 10.6 of additional grams of per day in protein, 30 grams per day of fat. Calcium 1000 milligrams, iron 60 milligrams per day, zinc is 11.8 milligrams and iodine about 200 micrograms. So I would like to conclude by saying that the plan that we serve our lactating mothers could be a meal plan that provides all these nutrients. So a combination of nuts and seeds to go with the morning cup of milk that would take care of calcium, protein, selenium, zinc, and definitely B12. The breakfast along with, for an vegetarian, a whole boiled egg, the type of complex carb or a low GI type of breakfast, which would give in the complex carbs and vitamins and minerals as indicated. A bowl of fresh fruits, locally available fresh fruits with some peanuts or the groundnuts, again would take care of the arachidonic acid. Lunch could be supported by including some beta carotene rich, so either a tomato or a carrot soup, going ahead with the protein from dals or legumes, and the probiotic based food in terms of curd. Evening snack could be distributed into snack 1 and snack 2, where ragi malt with a combination of seeds, basically pumpkin, chia, which could further look into the essential alpha-linoleic and linoleic acids. The sprouts or the boiled grams along with a guava, a rich source of vitamin C. And dinner, again, seeing that in a day you're providing for the fish eating population at least 30 grams of fish, along with otherwise the salad and the remaining components for a balanced meal. And the bedtime milk, we could further include the walnuts and some figs. So a combination is what we need to look at every meal, and small meals given frequently with very good hydration. Lactating mothers need to be given adequate hydration because there is enough fluid requirement for the daily 700 to 850 ml of milk that needs to be produced. Thank you.
Thank you so much, ma'am. It was a very interesting presentation. So from your profile also, I could see that your strong work on this particular area, breastfeeding and pregnancy. I think you are a very strong academician too in this. So we have few questions from the group, ma'am, in the chat. We got personally. So how to achieve 300 milligrams of DHA from vegetable origin?
So basically, I want each one of you to look into our NIN's dietary recommendation book. Very clearly, we have a table that's like a blueprint. You should keep that always handy. That gives you what is the serving that you need to take in so that you provide. So you start with your green leafy vegetables itself is one source that you can provide. So when we talk of a diet where you want to give green leafy vegetables not only for its calcium, not only for its vitamin beta carotene, this one, it also contributes to these linoleic acid. So always DHA will not come in. It is a conversion as we know. So we're looking at what are the components that can give alpha linolenic acid, and look at the nuts, seeds, as I just stressed on, and provision. So even fenugreek seeds is an option that can be. So it is not necessary that you provide all of them, but you can provide a balanced diet. It's very beautifully given there on how we can meet the 200 milligrams, if not 300 milligrams of zinc. So even for a pure vegetarian, and but still, if in that components you have mothers who do not like any of these, then of course you need to look at a supplement.
Next one is, what about the mother's health if she is undernourished?
So when a mother is undernourished, it is initially our assessment that decides that. I mean, we in practice have observed it is the family who pushes them so much to say that, oh, she doesn't eat anything. So please be clear. A qualified dietitian first has to assess what is the present nutritional status of the mother. Now, undernourished from point of is her total energy intake less. As various studies have very clearly shown, if the total energy intake that she requires per day, so what would that be? Her present weight, her weight gain that she has had. So go by that into at least approximate 30 kilocalories per kg body weight. She has to be getting that calorie per day. It will be anything above 2000 to 2500 calories based on her weight and weight gain. If she is eating less of it, that is the first criteria for us to weigh because her total energy intake itself is less. Then, of course, we need to look at the macro and the micro. What is she missing out? So, for an undernourished mother, when she is genuinely undernourished, is she taking lesser of, most of the time, it will be less of fat that we need to look into. I have seen undernourished mothers, if I talk of from point of total energy being less, that is typically our population who is not getting enough to eat. Second, malnourished mothers are mothers who have been very consciously eating and so then are actually missing out on essential fats. So that is one category. So always be alert to correcting them on it. Protein intake has not really been very low in the population that I've seen because even if it's a vegetarian or a non-veg, if they are actually eating twice some dal into their meal, if they are eating an egg every day and they're eating their quantity of cereal, the minimal optimal requirement of 12 to 15% of protein is met. What is not met, as I said, is the essential fats. So please look into the essential fats and how you can increase their energy intake from the carb source itself. Enough studies are showing if we can increase their carb intake, it will have an impact on their breast milk composition of protein and lactose. So I've always believed, please check on, depending on their BMI, you don't need to go to simple carbs. You always have your complex carbs. You have your other components to look into in terms of giving them a carbohydrate. So my version would be that.
Okay. B12 need to be checked for a vegetarian mother. Do we need to check a B12 for vegetarian mother?
Not really as checking on serum levels unless you have any specific deficiency symptoms that in your physical examination you are observed. But otherwise, you can actually on a long term. So one category of mothers is who would have frequent diarrheal spells or who have a very irritable bowel and who say that they are not really able to eat. That is a category, yes, we know that there might be a malabsorption of the B12 that they are taking also. So such cases, yes, we always would want the communicate it to the obstetrician and tell that should we be checking their serum vitamin B12 level and get that checked, right? Otherwise, again, it is basically giving them a supplement as a nutritional supplement to be given is only after checking their serum level. Do not start giving in just because it's a water soluble vitamin. A prescription of B12 as a supplement is not recommended in a lactation.
So should we recommend omega-3 supplements for lactating mother, ma'am?
In India, as I said, we are not got into yet a universal system, but we do have mothers who have been traveling and who have been told across the globe that it is good. So those who are already taking do continue the supplement. But as we have seen various studies, we are not specifically noticing. See, always remember, if the content is deficient in the diet, only then an additional supplement shows any additional benefit. Just because you take more of essential fats, the breast milk or the component is not going excess. This is one thing that we all need to remember. Only if there is a nutritional inadequacy from coming from the dietary intake, a supplement will help. Otherwise, a supplement is not going to help, or it might only end up being excess. In fact, we have noticed that, as I said, fat percentage in the maternal diet, if it keeps increasing, the human milk also has excess fat. And are we not unnecessarily causing more concern in giving more to that infant? We are putting in more risk of obesity coming in for no reason. I mean, there is no reason for us to be giving excess fat, even if it is through milk fat. So I
Is
would
there
not want
toxicity for omega-3?
this.
Is there
Pardon?
any toxicity for consumption of omega-3 fatty acids or supplement?
Not reported, Sri Priya, till now. We have not. So that's why it is still going on, right? So there is recommendations and there are studies still. So we have not reached a conclusive this. And there are two major studies that happen in India also, but we have not got a conclusive evidence which says that DHA supplementation is needed or not. Still in the transition.
There is one, like there are many boring questions for you. Like one question in chat box, even taking adequately all food, still not getting breast milk production when mother is stressed. Can you give any scientific evidence for this, ma'am?
Selena, valid question. First thing we always need to understand is breast milk production is a hormonal driven thing, right? So, as you rightly said, if a mother is stressed and trying to lactate, the letdown reflex does not happen. So, the first basic rule that we always say for every lactating mother is she should be relaxed. She should be trained much before her because the birthing process is not very easy. She would be tired and then getting on to put the baby onto latch. So if she is not prepared for a breastfeed, she'll find it difficult. And then the positioning of the baby to the breast itself is a major factor. So if the baby does not latch on properly to the areola region of the breast, it cannot cause. Third, the hydration of the mother. There is lot of many myths in our communities that the lactating mother is not given water. So when fluids are not given to a lactating mother, the nipple will be very dry and it actually tends to crack. Again, a reason for the baby not to suckle. So for a newborn baby, the first hour after birth is the most crucial to put the baby onto the breast to latch on. So even a natural birth or a baby born by C-section, we have to make it a point that the baby is at the breast because the baby is active then to latch on and gets a suckling. And the common thing that we all have to tell all lactating mothers is more suckling, more milk. No suckling, no milk. Actually, as a nutritionist, I have been telling everyone it is not the diet that comes first for good milk. It is the baby suckling that gets in more milk. So always concentrate on allowing the baby to suckle. The mother has to only take enough fluids, hydration, allow the baby to suckle, and there is milk. And then we concentrate on the diet to get more milk. So if the mother is stressed, she needs to be counseled, supported on these various things. There is scientific evidence because the let down reflex that the oxytocin gives, unless that is doesn't, if it doesn't work, there's no milk formation, right? A lactation counselor, I mean, I think all of you, if you know the IYCF, there's a lot of enough, you can get trained to be a lactational counselor, and there's enough work going on. And it works really well if you actually get the right position, right timing, all that matters. So we as nutritionists are a complement to that service that the counselors do. Yeah.
Thank you, ma'am. Basically, my PhD is on postpartum mood disorders. So
Right.
these are cases when really the psychiatric issues, generally any health condition doesn't affect the breast milk. Most commonly, the psychological impacts or the personal stress or if the child is in NICU, such conditions will impact. So what we as a psychologist suggest is more attachment, as you said, more coupling and have a kangaroo method. So that also helps in more bonding also. And again, whenever you face such situation, definitely we have to call a psychologist for help and get the patient counseled. That is very, very important. Okay, ma'am, moving
Great.
on to the next question. How much should be the fluid intake?
Yeah. So we would like to follow the standard thing of saying 2.5 to 3 liters of just water, right? Plus whatever fluids go in. Because when we are talking of a good soluble and insoluble fiber intake through this plant, adequate fluids would be required. So I always recommend having your fluids along with your meal also. Like I suggested, have soups, have buttermilk, have fluids with every snack that you take, apart from the water you take. So hydration, minimal of 2.5 to 3 liters is water plus fluids or fluid-based foods. Salina, yes, your Chico milkshake would have caused that increased weight gain. A big challenge always, lactating mothers should be very careful, though they are taking additional 600 calories in the first 6 months. We need to guide them that they cannot gain weight. They, in
But
fact,
one
have to
thing
retain
assure,
their weight or lose weight.
when one thing we can assure is once you properly breastfeed, once the breast milk is proper and properly breastfeed, you will lose the extra weight.
Exactly.
After the period, we can see that we are losing the extra weight. That is
After 6 weeks, yes, postpartum, you will definitely see because every ounce of breast milk produced is actually calorie burning. So it is a good way to lose all that stored fat which happens during the pregnancy, and it is good too. But it is the right way. As well, if you start taking high calorie options during after the 6 weeks, we notice that the weight gain bounces back.
And what I would suggest my patients is instead of milkshake and kind of things, I'll say that calcium rich ragi malt kind of things or like lemon juices and all those things I prefer. And
Directly avoiding sugars would be more than enough. Avoid the refined processed foods, avoid sugars. You can continue with all this. You can use a whole milk also and use milkshake, but use it with a natural sweetener
consider,
with your fruit than going for additional sugars. That causes the biggest problem.
is the less production of milk any link with heredity?
No. I, in practice, have not observed so, and I also don't relate it to any evidence that I have come across. More than saying heredity, yes, it's related to the environmental factors. As Dr. Sripriya well said, yes, it is the environment that matters a lot. So diet is one part of your component of your environment, but there are other physiological concerns that can come up or any medical concerns that can come up. So which can be a reason. Yes, because very high BMI, I mean, if you talk of excess BMI than 40 for a mother can be a factor for reduced milk production. So that like that, there are various. That is again in terms of excess fat on the breast tissue does not allow the baby to latch on or lactate properly. So it is again coming back to not able to position properly. So there are various factors. You can't point on one and say that is the reason, but it cannot be related to any genetic factor. Not heredity has not till now been reported as far as I am aware. If any of you all have come across any reports, I would happy to share, but I have not come across it.
Any studies on osteoporosis risk for mothers who don't take calcium supplements? And in lactation period, how many milligram supplements, calcium supplements required?
So the recommendation as now the latest ICMR-9 says 1000 milligrams per day. So it is better to ask our mothers to continue taking 1000 milligrams of calcium supplement along with a calcium rich diet in the, because all of us know the absorption of calcium is definitely not complete. So it's better that during the lactation phase of the first 6 months, at least continue with 1000 milligrams of calcium tablets as supplements, and then all the calcium rich sources.
Okay. Is there any link between colic pain of the babies and the mother's diet specifically, ma'am?
Yes, there is to some extent, yes. Again, this is called spoke from the point of, I always would like every dietitian to remember that the food components that the mother is taking or drinking, it should be something which is suitable for her gut. So when a mother starts taking something which she's not used to, and she ends up in a flatulence or lactating this one, she is uncomfortably sitting and feeding her baby, can be a reason for the baby also to be uncomfortable. Now, the colicky pain for the baby, as we all know, is either gulping in too much air by the baby or certain foods which can cause the baby also to get that component. So certain foods, as we all know, have been identified. So for some, yes, simple things like even cabbage, cauliflower, or even cucumber, onions can also cause lot of pain. For some, the dals like the chana dal can cause a thing. So when we notice more than us, the neonatologist immediately grabs the thing and tells the mothers, you have to stop these because it doesn't seem to be agreeing. Now, is that the direct component reaching the breast milk? It is not so. It is more to do with the flatulent component which is causing in. So if you observe any symptoms, it is not uniformly that for everyone it will be the same. If you observe any symptoms related, we do advise the mother to stop that particular food group and continue later when the baby is better, right? And garlic has shown to be supportive and also for some causes colicky. So again, it is true. So garlic works like a galactagogue for some of them. So eating adequate garlic, the smell of garlic seems to attract babies, and so babies suckle better. But again, there are few mothers, for the mothers themselves, garlic might not agree to their gut. So for these mothers must be it will not support. So let's be able to customize it for as per the mothers and the baby's relation. That's all it is. Supriya, you're muted, ma.
Is there any online lactation counseling courses available in India, ma'am?
Not really, except for this course I know is by IBCF what they provide, but that is not an online thing. It's a full-time certificate course that you have to go through. Online must be available across, but I don't vouch for it. Is it genuinely done or not? But certified, I'm not sure.
And one last question from my side. I want to ask you, like in the recent.
Thanks, Pooja. Pooja says, yes, MSM from IIT Mumbai. Pooja Singhania is another one of our very good counselor in the country.
Okay.
Hi, Pooja.
Hi, Pooja.
Yes, good afternoon.
Yeah.
So what I wanted to ask is, in my practice, I come across many pregnancy cases these days. Many women, like as Selena said, my very concern because they are not only controlled by their gynecologist and sometimes GDM is high and they themselves are controlled by social media. For so many factors are there. So pregnancy is very high. How many of the patients you are seeing in your patient, like practice?
Not much here in Hyderabad. I mean, to my population, must be our hospital is not getting much. But as you rightly said, yes, there is an increased incidence for us. But we are getting enough mothers now who want to practice veganism. That's there. I mean, earlier, 2 years back, I didn't have so many. Now, the number of vegans who walk in and say, "No, ma'am, we need your support. We need to continue with," and they need us to support convince their family. So that is why the support comes. So they are adamant they want to continue, but we as trained people have to convince their family that it's okay. So in that, I have noticed a major change. I mean, a number of young girls coming forward to continue. But anorexia, not really, Shripriya. I'm not in my population seen much as such. But postpartum depression is on the increase. Yes, as you rightly said, it's very alarming for me. In fact, every month the number of cases reported have been coming more. We in our hospital have started actually an early screening also in the last trimester. So our mothers go through a basic screening process in the third trimester to identify if any of them are at any risk and get are given support by our psychologist team who actually prepares them. But otherwise, the numbers were increasing. We had, I used to always think, I was under the impression it was the primaries who would actually be more prone to, but I was surprised that even we had gravid 2s and gravid 3s going into postpartum depression. So that was surprising for me. True.
That
The stress of life is all adding on to it. True.
honestly, when I did my PhD during 2008, I couldn't see much of this postpartum mood disorders. It was very, like, numbers was very less. And but now, unfortunately, our education is increasing. Along with that, the problems is also increasing. We
Amazing, I
have
know.
some actions. And it was always our Sharon ma'am's, like, she always say that we should plan something, bring out some consensus on maternal nutrition. Definitely, we
True.
have Sharon Chechi. Will you be able to? I think she is on duty.
Okay.
Yeah.
Thanks, Shireen. Saw your message. I
Yeah.
was actually, yes, we are working on it. And with IPEN, the present core group, that's where I thought through the association, at least we should come up with some consensus. Also told at NIN that we need to get someone on board from there too, so that we get a proper consensus across the various uh, groups of socioeconomic strata being covered. That's important. Thanks, Dr. Pooja. There's a couple of online courses that Pooja has
Copying
shared
that.
on there. Yeah.
Yeah.
Yes. All of you all could share this with the others. Yes.
Yes, that's so nice of you, Pooja. So I invite Miss Anita to give vote of thanks.
Thank you.
Good evening, everyone. On behalf of the Community Nutrition Forum, it is my privilege to extend a heartfelt vote of thanks at the conclusion of today's enlightening section, Maternal Nutrition Status and its Influence on Breast Milk Composition. First and foremost, I extend our deepest gratitude to our esteemed speaker, Dr. Latha Sashi, Chief Nutritionist and Head, Department of Clinical Nutrition and Dietetics, Fernandez Hospital, Hyderabad. Ma'am, your insights on how maternal nutrition directly shapes the very first food of life, breast milk, have not only deepened our scientific understanding but also inspired us to apply this knowledge in practice. We are truly grateful for your time, expertise, and dedication. Thank you so much, ma'am. A sincere thanks to all our participants for joining us today and making this section interactive and more meaningful. We also thanks to organizing team of our Community Nutrition Forum, especially Sri Priya ma'am and Sherry ma'am, for their hard work behind the scenes in planning and executing this wonderful section. As we close, let us carry forward today's key message that empowering mothers through proper nutrition is the first step towards building healthier generations. Thank you once again for your presence and support. Have a wonderful evening. Thank you so much.
Thank you so
Thanks,
much.
Anita. Thanks, Shireen, also. And Shripriya, thank you for having me here.
Thank you so much.
Interesting and informative session, and really, definitely those who are like missed the last session, like we had almost around more than 40 participants in the beginning. In between we have break. Definitely the session will be like in the YouTube also, so definitely others also can make use of that. Thank you so much, ma'am. Yeah.
Thank you, Shireen, so much.
Thank you so much.
Bye, everyone. Yeah,
Bye. Have a happy week ahead.
thank you.